Hello everyone, welcome back to Sowkya Vision. Today we are going to see anemia. So what is anemia? Yes, anemia is a symptom. It is a symptom of blood disorders. Yes, it is defined as decreased oxygen carrying capacity. Yes, it is occurred when there is oxygen carrying capacity is decreased. That occur due to quantitative and qualitative reduction in RBC counts and HB levels. If there is decreased in the number of RBC or there is decreased in the HB levels, it results in anemia. There the oxygen carrying capacity is deficited. Yes, it is diminished. So it results in anemia. So the normal RBC count is how much? Yes, it is about 4.5 to 5.5 millions. So the hemoglobin content is 12 to 16 grams per deciliter. So if there is decreased in this content, the hemoglobin content, it leads to anemia. If there is decreased in RBC count, it leads to anemia. Yes, the symptom is anemia. The oxygen carrying capacity is decreased. So the hemoglobin normal range is 12 to 16 grams per deciliter. Now, when there is decreased in hemoglobin content, that is, if it is less than 8 to 12, it is considered as mild anemia. Yes, it is considered as mild anemia. See, if the hemoglobin is decreased, it is less than 5 to 8, it is known as moderate anemia. It is considered as moderate anemia. So if there is less than 5 grams per deciliter, it is considered as severe anemic condition. If there is less than 5 grams per deciliter, it is considered as severe anemic condition. So when it occurs, if there is reduction in RBC count, as I said, if there is less RBC or there is less hemoglobin content or there is less PCV, packed cell volume, if there is less PCV and less RBC and less hemoglobin content, there will be deficiency of oxygen. Yes, there will be deficiency of oxygen carrying capacity. We know that hemoglobin has the capacity to carry the oxygen. If there is less RBC, obviously there will be less hemoglobin. Yes, less amount of hemoglobin carrying the oxygen. So the reduction in RBC count, if there is less number of RBC, the reduction in HB content, if there is less hemoglobin, if there is reduction in the PCV, that leads to anemia. So when these occurs, when there will be reduction in RBC, if there is decreased production of RBC, yes, the decreased production of RBC or increased destruction of RBC. See, after 120 days, the RBC get destructed, right? So if there is decreased production of RBC, if there is increased destruction of RBC, there will be resulting in anemia. And one more is excess loss of blood from the body. If there is excessive loss of blood from the body, that leads to anemia. Yes, what are the three main causes? There will be decreased in production of RBC or increased destruction of RBC and excess loss of blood from the body. These three causes leads to condition called anemia. Yes, now let's see the classification of anemia. The anemia is broadly classified into morphological and etiological, whereas morphological is classified into different types based on the size, color of RBC. Yes, the morphological classification is again further divided into many classes based on the size and the color of the RBC. So what are these four classes? They are normocytic, normochromic, microcytic, normochromic, macrocytic, hypochromic, microcytic, hypochromic. So what are these? Normocytic, the cell structure is normal. Normocytic, the cell structure is normal. Normochromic, chromatin content is normal. So normocytic, normochromic. Yes, macrocytic, normochromic. Macrocytic means what? Large size of cell. Whereas the chromatin is normal, normochromic. Macrocytic means, macro means what? Large, right? So macrocytic and normochromic. One more, macrocytic, cell is macro, cell is large, whereas chromatin is less. Yes, one more is microcytic hypochromic, whereas the cell is very small as well as chromatin content is also less. So what are the 4 classifications under morphology? The normocytic, normochromic, macrocytic, normochromic, macrocytic hypochromic, microcytic hypochromic. Yes, there are some other important anemia. So let's see them. First one is iron deficiency anemia, which is very common in India, Indian women mainly. So what are the causes of iron deficiency anemia? The iron deficiency anemia caused due to excess loss of blood. If there is excess loss of blood, it may occur during accidents, any hemorrhage, or in excess bleeding, or excess bleeding during menses. Yes, excess loss of blood and decreased intake of iron. Yes, iron, from where we get iron? It get from the food that we take. After metabolism we get the iron. So if there is decreased intake of iron, and if there is poor absorption of iron from the intestine, see, iron directly we cannot inject into blood, right? So we take the iron from the food content, and that is absorbed from the intestines to the blood vessels, capillaries. Yes, so these are the causes for iron deficiency anemia. Yes, it occurs due to loss of blood, decreased intake of iron, poor absorption of iron from the intestine. Yes, it occurs mostly in the women. Yes, women are at risk. In women there will be more cases of iron deficiency type of anemia. And the one more is megaloblastic anemia. Megaloblastic. See, megalo means what? Megaloblastic means what? The size of cell, the size of RBC is large. Yes, the size of RBC is large. In the process of erythropoiesis, the cell that is from the megaloblastic stage to the matured RBC, the size of the cell is gradually decreased. Yes, as it is getting matured, the size of the RBC get reduced from megaloblastic stage to erythrocytic stage. The size of the cell is reduced. So this anemia occurred when the RBC is not matured. If the RBC is not matured, then it is called megaloblastic anemia. So when it occurs, it occurs when there is deficiency of folic acid. Normally the folic acid function is to mature the RBC, is to develop the RBC, mature the RBC. If there is folic acid deficiency, the RBC is not matured. If the unmatured stage of RBC is what? Megaloblastic stage. Yes. So if there is deficiency of folic acid, that leads to RBC immaturity. Yes, if the folic acid is deficient, the RBC is not matured. So the unmatured stage of RBC is what? Megaloblastic stage. So if there is decreased folic acid or deficiency of folic acid, that leads to megaloblastic anemia. So what are the symptoms? The skin becomes yellow in condition. The skin becomes yellow condition, and throat red soreness, and muscle weakness with ataxia. Yes, the muscle weakness and ataxia. What are the symptoms? Yellow color of skin, red sore throat, muscular progressive weakness, and ataxia. And the third one is pernicious anemia, or it is also known as Addison's anemia. What is the cause? It is caused due to deficiency of vitamin B12. It occurs due to the deficiency of B12. What is the function of B12? Vitamin B12. It helps in maturation of the RBC. Hence, it is also known as maturation factor for the RBC. Yes, the pernicious anemia is caused due to the deficiency of vitamin B12. The function of vitamin B12 is to mature the RBC. So it is known as maturation factor of RBC. So if there is vitamin B12 deficiency, the RBC is not matured. Yes, when there will be deficiency of B12, vitamin B12, when the gastric mucosa, when there is destruction in the gastric mucosa, the gastric canal, the tract, GIT tract is lined by mucosa, right? So due to destruction of gastric mucosa, there will be deficiency of vitamin B12. Yes, if there is destruction, there will be decreased in the intrinsic factor. Yes, this intrinsic factor helps, generally the intrinsic factor helps vitamin B12 to be absorbed. If the vitamin B12 is absorbed in the presence of intrinsic factor, if there is no intrinsic factor, vitamin B12 cannot be absorbed. Yes, if the vitamin B12 cannot be absorbed, there will be deficiency, obviously. Yes, that deficiency lead to immature RBC that looks very large, megaloblastic. Yes, again megaloblastic or all other immature stages. HB content will be low. The HB content will be low. So this condition is known as pernicious anemia. Pernicious anemia occurs due to deficiency of B12, vitamin B12. Why deficiency of vitamin B12? There is absence or decreased deficiency of intrinsic factor. Vitamin B12 is absorbed in the presence of intrinsic factor. So if the intrinsic factor is not there, there will be no absorption of vitamin B12. Yes, now what are the symptoms? See, the pernicious anemia is most common in old age people and female. So the symptoms are yellow colored skin, sore tongue, neurological disorders like paresthesia and progress weakness and ataxia. Once again, it is also occurred the female and yellow color of skin, sore tongue and progressive weakness is also seen in megaloblastic anemia. And the next one is aplastic anemia. What is aplastic anemia? The aplastic anemia occur due to the disorders of red bone marrow. Yes, if there is replacement of red bone marrow by fatty tissue, if the red bone marrow is replaced by the fatty tissue, then that leads to anemia known as aplastic anemia. In which conditions there will be disorders of red bone marrow, in which condition it is replaced by fatty tissue? These are excess exposure to X-rays and gamma rays and presence of bacterial toxin and quinine, etc. And the bacterial and viral infections like and carcinomas like tuberculosis, hepatitis and HIV infection. In these conditions, the red bone marrow is replaced by the fatty tissue, resulting in aplastic anemia. Now, let's see the overall symptoms. In any condition, the symptoms of the anemia are these. These are the common symptoms in any type of anemia. So, there will be increased metabolic rate. There will be increased metabolic rate and enlargement and dysfunction in case of sickle cell anemia. Yes, jaundice occurred in case of hemolytic anemia. Anorexia, nausea, black stool, menorrhagia, skin become pale, yellow, dry, headache, loss of concentration, restless, irritability, vertigo, fainting, easily fatigued. These are the symptoms of anemia. These are the main symptoms, general symptoms of all types of anemia. Yes, this is the complete discussion of anemia. There are four main anemia classification. What are they? Iron deficiency, megaloblastic, aplastic and pernicious anemia. So the iron deficiency anemia is caused by, it is occurred due to loss of blood or less intake of iron or poor absorption of iron from the intestine. Megaloblastic anemia occurred due to deficiency of folic acid. Yes, now the pernicious anemia is occurred due to deficiency of vitamin B12. It is occurred due to poor absorption. Yes, it is absorbed. It is occurred when there is decreased or diminished intrinsic factor. And aplastic anemia is occurred due to disorders of red bone marrow. Mainly it is replaced by the fatty tissue, resulting in aplastic anemia. So this is complete discussion of anemia. If you like the video, please do comment, like, share the video, subscribe to the channel. Namaste.